Good friend of ours now, Dr. Anuj Bhargava is here, and you brought a guest. We'll introduce the guest in just a second, but tell everybody the organization that you're with.
Good morning. Here for diabetes research in Iowa with the Iowa Diabetes and Endocrinology Research Center, Iderc, and we have talked about in past the website iowadiabetes.com. Just here to tell people about the amazing research opportunities we have, and then sharing Dan's experiences, how it has worked out for him.
Okay, exactly. We have Dan Olson is joining us, and you mentioned that people can get involved in the program.
Yeah,
Jackie.
these trials that you do
Right.
to
Yes.
really get to the advancement of diabetes, but it's working.
Yes.
These trials that are happening.
So we have a number of different trials happening right now. Patients with type 1 diabetes, there are trials with long-acting insulin, short-acting insulin, new kind of meters, pumps and sensors. Type 2, again, long-acting insulin, short-acting insulin, and a number of different pills and shots. So just a number of different options. You know, we know that diabetes is such a major problem for our healthcare systems. So the research in this area is amazing. There will be like 186 new medications in the next few years, which are in pipeline right now.
Wow.
And again, we are very lucky right here that we can bring some of these medicines and latest treatment options to central Iowa.
And try them and
Absolutely.
make sure that they do the job they're supposed to do.
Yes.
And Dan, how did you find out about this first of all?
I was referred to the research center through my endocrinologist right there at Mercy Hospital, along with Dr. Bhargava.
Okay, so what type of diabetes do you have?
I have type 1 juvenile diabetes.
Okay, and so when you first came into the program, were you a little nervous, a little apprehensive about this? Or?
Actually, I was really interested in getting involved with this because I want to do my part and do what I can to make life better for future diabetics.
So what's the process been like? Was it easy? Was it hard?
It was very easy.
Really
It's
easy,
very
okay.
Yeah. It's just a matter of getting in contact with somebody at the research center, and they'll explore with you the options that are available for studies that are going on at the moment. And
all right, so what did you have to do?
qualify.
Do you have to change where you ate or anything, or what exactly did you have to do?
To be part of the study, I didn't have to, because as a diabetic, you're already eating pretty healthy and
Right.
taking pretty good care of yourself. So it's not that big of a change, really. Not really at all.
So the primary focus of your study was what?
Well, I've been on 3 different studies. 2 of them have been testing generic versions of insulins that are available right now, and then another one was an insulin that titrated over a longer period of time, which means that you could take your long-acting insulin anytime over a 24-hour period, instead of like the insulin I'm on right now. You have to take it either in the morning or at night, and you have to have a pretty strict regimen with it. But the one experimental medication that I was on, you didn't have to do that, and that was pretty great, and it's going to make life a lot better for a lot of people.
So did it work for you then?
Oh, yeah, absolutely. Yeah.
As you
You
say,
have a grin on his face, Jackie.
Yeah, well, what have these trials done for you? Have they educated you about your disease, or you just feel like you're doing this in the name of science?
I think that everybody that has diabetes and puts up a good fight is already pretty well educated on it. You have to be.
Right.
I think basically what I'm doing now is trying to make it better for people that are going to have it down the road. My sister got diabetes in 1983, and the technology, the advancements that we've had since then are just amazing. I mean, she had a blood meter the size of a brick that she had to carry around with her everywhere to test her blood, and today I've got a tiny meter, and if you ask 90% of the people that know me, they don't even know I have diabetes.
Really?
Yeah.
Wow.
So,
And it's kind of incredible that a lot of this is being done right here in central Iowa. I don't think people even realize what's going on.
Yeah. Mm-hmm.
Yeah, very lucky that we have so many different kind of trials. And you know, at IDERC, we're just very committed to changing diabetes, doing our part in improving the health and lives of people affected by diabetes. One of the things I want to point out, Dan, means his experience, or the time that people are able to spend with him, or the medications, the meter strip supplies. Those are some of these intangibles that also help. And I think that relationship that patients develop, and the fact that Dan and many others come back because these clinical trials help them, and also, you know, this relationship puts them in this mindset, I have to do this, I have to check my sugar, I have to bring that in, and I think those are some other intangible things with the trials.
Well, Dan, some people might be hesitant because they're scared of what it might be involved if they have to drastically changed their life, or they're afraid of using something that might not fit with their lifestyles, what would you say to those people?
I would say that is incorrect because I haven't had to make any changes at all. I mean, I'm already taking medication. I'm just taking something else instead of what it was on before, something new.
And Dr. Anuj, you said these trials are going on all the time.
Yes, we launch 1 or 2 trials each time, and the best way to keep updated on these is to go to our site, iowadiabetes.com. There they can register and into different kinds of studies. This is being shown is a type 1 study. There's another study with type 2. And the best way is to go to the research center website. That site is the iderc.com. And also, just for this program, we have the iowadiabetes.com. They can go there, register, and from there they can go to our site, know about all these studies that are going on.
And how long of a period of time, if somebody wants to get into a study, how long do they have to dedicate to you?
The typical studies, Lou, are 6 months to a year. So that's typical. But then we also have some long-term studies. But mostly it's 6 months to a year.
And you can come back more than once?
Absolutely.
Okay.
Once the study is done, after a month, 2, if there's another study that fits, you can.
All right, so this is something you might want to consider.
That's what I'm saying. To hear it, from someone who's been through those trials, it's nice to hear that, this is not only working from the doctor and science aspect, but this is something that can really improve you on a personal level as well.
Correct.
Wonderful.
That's great. Well, Dr. Anuj, thank you so much.
Thank you.
It's really neat. You brought somebody in here to show that it does work.
Thank you, Dan, for being here today.
Thank you.
Thanks, Dan. Appreciate it. It is 8